Dr. Michael Lawson and Dr. Isabella Cruz had spent 10 years hiding a secret in plain sight, an affair so meticulously concealed that no one suspected a thing, not even the hospital that trusted them with lives. But during a routine heart surgery in Los Angeles, their decade-long deception unraveled in a way no one could have predicted. The surgeon's life in Los Angeles looked carefully designed to inspire trust. From the moment he entered the hospital each morning, everything about him suggested discipline and control. His white coat was always clean, his movements calm, and his reputation built on years of successful heart surgeries. Patients often requested him by name, believing his hands carried a rare mix of precision and confidence. To the outside world, he was not just a doctor, but a symbol of safety in a city where medical excellence was expected and admired. His rise had been steady. After years of training, long nights, and relentless ambition, he earned a place among the top cardiac surgeons in Southern California. Medical boards praised his results, and hospital administrators relied on him for the most difficult cases. He attended conferences, donated to health charities, and appeared in promotional material that highlighted the hospital's success. His image was polished and dependable, shaped by years of careful behavior and professional discipline. At home, his life seemed equally stable. He lived in an upscale neighborhood where privacy was valued, and his routine rarely changed. Early mornings, late nights, and frequent emergency calls were normal for someone in his position. These long hours explained his absence from social gatherings and family events. No one questioned it. In medicine, sacrifice was often seen as proof of dedication. Inside the hospital, his authority was unquestioned. Nurses followed his instructions without hesitation, junior doctors watched closely to learn from him, and administrators trusted his judgment. He understood the system well and knew how to navigate it. He never raised his voice or caused scenes. Instead, he relied on quiet influence and respect built over time. This made him almost invisible when it came to suspicion. People rarely doubted those who appeared calm, successful, and consistent. What few people noticed was how carefully he protected his privacy. He avoided casual friendships at work and kept personal details vague. His phone was always close, his schedule tightly controlled. These habits seemed normal for a surgeon under constant pressure. In reality, they were part of a much larger effort to keep two separate lives from colliding. The hospital itself played a role in hiding the truth. With hundreds of staff members, rotating shifts, and constant emergencies, personal relationships often went unnoticed. The surgeon blended into this environment perfectly. His long hours provided cover, and his status discouraged questions. Even when patterns appeared, they were dismissed as coincidence or the result of professional commitment. Over time, his confidence grew. Years passed without exposure, reinforcing the belief that his secret was safe. Each successful surgery strengthened his public image, while each unnoticed day made the hidden life feel permanent. The risk faded into the background, replaced by routine. What began as a careful balancing act slowly turned into complacency. Yet beneath the surface, the pressure of maintaining perfection never truly disappeared. Every controlled movement, every carefully chosen word, and every late night carried the weight of a secret that could destroy everything. The surgeon knew that one mistake, one unexpected event, could unravel the image he had spent decades building. In a profession where timing and precision mattered more than anything else, it was easy to forget that life did not always follow plans. The operating room demanded focus, but it also recorded everything. Machines did not care about reputation or status. They measured actions, seconds, and patterns without emotion. And while the surgeon believed he had mastered control over his world, the first cracks were already forming, unnoticed, waiting for the moment when perfection would fail. The anesthesiologist had built her career quietly, without shortcuts or favors. She arrived in the United States with determination and patience, knowing the path would be long and demanding. Years of study, licensing exams, and exhausting hospital rotations shaped her into a professional who relied on precision rather than recognition. By the time she joined the Los Angeles hospital, she was already known among staff for her steady hands and calm focus during critical moments. Her role placed her in the background of every surgery, close enough to influence outcomes but rarely noticed by patients. She monitored vital signs, adjusted medication levels, and kept bodies balanced between pain and survival. Mistakes in her field were unforgiving, and she understood this deeply. That awareness made her disciplined and cautious, both inside and outside the operating room. Working alongside the heart surgeon became routine, their schedules aligned often due to the complexity of cardiac cases. Over months, then years, familiarity replaced formality. Trust grew through repeated success, reinforced by procedures that ended well. The hospital environment encouraged closeness without intimacy being obvious. Long hours, shared responsibility, and constant pressure created a space where boundaries could blur quietly. The relationship did not begin with recklessness. It formed slowly, hidden beneath professional necessity. Late, night procedures and emergency calls became predictable opportunities for isolation. The hospital's size and pace allowed personal connections to exist without attention. Masks, gloves, and surgical lights created distance from the outside world, making secrecy easier. For the anesthesiologist, the relationship carried both comfort and risk. She understood the imbalance of power and the consequences if the truth surfaced. Yet the routine became familiar, almost structured. Their interactions followed patterns shaped by schedules and operating rooms rather than public spaces. There were no shared social events, no visible signs. Everything stayed contained within hospital walls. As years passed, the secrecy hardened into habit. 10 years slipped by unnoticed by colleagues. New staff members arrived, others left, and administrators changed. The affair remained untouched by time. It survived policy updates, compliance training, and internal audits. It survived because it never announced itself. However, the cost of secrecy was constant control. The anesthesiologist learned to compartmentalize her life with precision equal to her work. Emotions were buried under professionalism, every action was measured. She avoided close friendships at work and limited personal exposure. This isolation slowly reshaped her identity, making the secret feel like a second career that required constant attention. The danger grew not from exposure, but from comfort. Repetition created a sense of safety. The hospital became a predictable environment where nothing seemed capable of disruption. With each passing year, the idea of consequences felt distant. Rules began to feel flexible, shaped by experience rather than policy. Small decisions were made quietly, justified by trust and familiarity. Professional lines blurred further when schedules were adjusted without formal review. Assignment preferences went unquestioned. No alarms were triggered because outcomes remained successful. The system rewarded results, not process. As long as patients survived, the details stayed hidden. What neither of them considered was how modern medicine remembered everything. Digital records tracked timing, access, and coordination. Machines noted patterns humans ignored. The operating room never forgot. While the affair remained invisible to people, it was slowly being documented by systems designed to observe without judgment. By the end of the 10th year, the relationship felt permanent, embedded into daily routines. It no longer felt risky, only necessary. Yet beneath the surface of stability, the structure depended entirely on silence. One unexpected event, one irregular moment, could collapse everything. And in a hospital built on precision, unpredictability was always waiting. The day of the high-risk heart surgery began like any other, with the hum of hospital life filling the operating room. Nurses adjusted equipment, monitors beeped rhythmically, and the anesthesiologist moved with quiet precision, ensuring every line and tube was correctly placed. The patient was a prominent figure in the city, someone whose health status demanded the very best expertise. For the surgeon, this case was routine in skill but high in stakes, a challenge that required perfect timing and absolute coordination. From the start, something felt slightly different, though no one could yet define it. The surgeon followed his usual meticulous process, but subtle inconsistencies began appearing in the monitoring data. Heart rate fluctuations, oxygen level adjustments, and minor timing delays were recorded, but in isolation, each seemed explainable, a common variation in complex surgery. The anesthesiologist's responses were precise but followed a rhythm slightly off from the usual protocol. At first, these discrepancies were dismissed as normal. As the surgery progressed, the patterns became more pronounced. Anesthesia adjustments occasionally preceded surgical steps, an inversion of the standard procedure. Small errors compounded, creating brief moments of instability in the patient's vital signs. Though nothing catastrophic occurred, the situation triggered the hospital's internal alert system. High-risk surgeries always generated post-operative reviews, but the anomalies in this case demanded immediate attention. After the surgery, a routine audit of digital records revealed an even clearer picture. Past surgeries were compared with the current one, and an unsettling trend emerged. Whenever this particular anesthesiologist and surgeon worked together, similar inconsistencies appeared, subtle but recurring over the years. The operating room, once a place of unquestioned trust, had inadvertently documented evidence of a pattern that no one had noticed before. Hospital administrators began digging deeper. They examined logs, schedules, and patient outcomes spanning a decade. Each record confirmed what the monitors had quietly preserved. The relationship between the surgeon and anesthesiologist, hidden behind masks and gloves, had influenced professional decisions. While no patient had been critically harmed, the potential for disaster was evident. Minor deviations had been masked by experience and luck, but the consequences of future mistakes loomed large. The revelation shocked the internal review team. They were trained to investigate errors, not personal relationships, yet here the two were intertwined. The story was not about one careless act or a single oversight. It was about years of subtle, repeated patterns that went unnoticed because the human eye trusted reputation over data. The operating room, with its constant monitoring and recording, had become the silent witness. By now, it was clear that the case was bigger than a single surgery. Investigators realized they were looking at a decade-long series of events, each seemingly ordinary but cumulatively significant. The intersection of personal relationships and professional responsibility had created a situation that no policy alone could have predicted. Trust, carefully built over years, had become both a shield and a risk factor. The hospital faced a difficult choice. Revealing the situation publicly could damage reputations and invite lawsuits, but ignoring it could endanger lives. The review team decided to proceed methodically, ensuring every step was documented. Digital evidence, timing logs, and surgical data became the backbone of the investigation, replacing hearsay and speculation with precise records. The surgery that had begun as routine now marked the turning point in a hidden story. What was meant to be a standard procedure had exposed a decade of secrecy, demonstrating that even the most controlled environment could not conceal human complexity. In the quiet of the operating room, where life hung in balance, the truth had revealed itself, not through confession or confrontation, but through patterns too precise to ignore. The hospital's investigation began quietly, at first confined to a small team of administrators and compliance officers. They reviewed digital logs, access records, and patient charts with painstaking care. Every detail was scrutinized: who entered the operating room, at what times, and how long procedures took. The patterns identified during the high-risk surgery were no longer isolated anomalies. They repeated across months and years, forming a trail that pointed unmistakably toward a single conclusion. What had once appeared as routine diligence now revealed a web of professional and personal entanglement. The anesthesiologist and the surgeon had worked together on hundreds of cases, and in many of them, subtle deviations were documented. Small changes in medication timing, unexplained adjustments to surgical protocols, and patterns of synchronized activity were noticed when viewed collectively. Individually, these irregularities might have seemed inconsequential, but in combination, they suggested a troubling overlap between personal loyalty and professional responsibility. It became clear that their secret relationship had subtly influenced decision-making in ways the hospital could not ignore. As the investigation deepened, other staff members were discreetly interviewed. Many described the surgeon and anesthesiologist as exceptionally competent, professional, and reliable. No one suspected anything unusual. Yet the auditors noticed that certain behaviors, late-night schedule swaps, unexplained absences from shared meetings, and a consistent pairing during high-risk surgeries, had been overlooked or dismissed. What had once been interpreted as dedication or efficiency now took on a new, more concerning context. The hospital faced mounting pressure. Administrators understood that ignoring the situation could have legal and ethical consequences. Patient safety was paramount, and the evidence suggested that personal entanglements had introduced risk. Regulators were informed, and external auditors were brought in to ensure an impartial review. The investigation extended beyond just observing records. It examined outcomes, decisions, and the potential impact on patients over the years. What emerged was a portrait of repeated boundary crossings where professional judgment may have been influenced by hidden personal connections. Suspension orders were quietly issued for both the surgeon and the anesthesiologist, pending the final review. It was a delicate process. Reputations, careers, and public trust hung in the balance. For years, the two had operated under a carefully constructed veil of secrecy, but now the systems designed to protect patients were uncovering the truth. Even as their privileges were restricted, the hospital had to ensure that emergency surgeries and patient care continued without interruption. The story eventually reached the media, though details were initially sparse. Rumors circulated within the city, but the specifics were kept confidential until the official review concluded. The public reaction was swift once the information became known. A respected surgeon, admired for skill and dedication, and a trusted anesthesiologist were suddenly at the center of a scandal that spanned a decade. Shock and disbelief rippled through professional circles, patients, and the broader community alike. The narrative of excellence had hidden a complex and risky personal dynamic for years, and the revelation felt almost cinematic in its implications. For the investigators, the task was not only to document what had occurred, but to understand why it had gone unnoticed for so long. They analyzed hospital culture, staff hierarchy, and administrative oversight. One conclusion became clear: high competence, reputation, and routine dedication can inadvertently create blind spots. Systems designed to monitor performance had been circumvented not by malice but by secrecy and familiarity. This realization would have lasting effects on hospital policy, training, and internal review procedures. By the end of the investigation, it was undeniable that the affair had evolved from a private relationship into a professional and ethical crisis. The personal became public, the hidden became visible, and the consequences of secrecy reached far beyond the individuals involved. The hospital, regulators, and the public were left to grapple with the realization that trust, even when deserved, could mask dangerous patterns. The case had transformed from a story of individual misconduct into a cautionary tale about oversight, ethics, and the risks of mixing personal loyalties with professional responsibilities. The fallout from the investigation was swift and uncompromising. Both the surgeon and the anesthesiologist faced immediate suspension, but the consequences went far deeper than temporary removal from duty. Licenses were reviewed, and professional boards scrutinized years of surgical records for evidence of misconduct or negligence. Every procedure they had conducted together became a point of interest, and in some cases, families of patients demanded explanations for past outcomes. The hospital itself faced intense pressure, both legally and publicly, as media outlets began covering the story in sensational detail. The surgeon, once celebrated as one of Los Angeles' top heart specialists, saw his carefully curated reputation crumble. Invitations to conferences and speaking engagements vanished. Colleagues distanced themselves, uncertain how association with him might affect their own careers. Meanwhile, the anesthesiologist experienced a similar professional and personal upheaval. Years of meticulous work and the sacrifices she had made to build her career were overshadowed by the revelation of her secret relationship. Friends and peers who had once admired her composure now questioned her judgment and ethics. Patients became a vocal and concerned part of the story. Families demanded records, explanations, and assurances that no harm had come from the doctor's personal entanglements. Each inquiry uncovered subtle but recurring deviations in surgical patterns that, while not directly causing harm, highlighted the potential risk to human lives. The hospital worked to provide transparency, offering audits and independent reviews to reassure patients, but the breach of trust had already left a lasting mark. What had once been a place of safety and confidence now felt vulnerable and uncertain. The public exposure forced the hospital to rethink its policies and internal systems. Digital monitoring, once seen primarily as a tool for efficiency, became an essential safeguard against human error and misconduct. Strict guidelines were introduced to prevent personal relationships from influencing professional decisions. Staff received additional ethics training, emphasizing the importance of boundaries and accountability. The hospital's administration made it clear that no level of skill or reputation could excuse lapses in judgment that put patients at risk. Both doctors faced legal and regulatory scrutiny, though criminal charges were not filed. Instead, the focus was on professional accountability and the broader implications for patient safety. The investigation revealed that a decade of careful secrecy had relied on luck, timing, and the blind trust of colleagues. It became a stark reminder that in high-stakes environments, even small personal choices can have far-reaching consequences. Every minor deviation, every hidden action, could compound into a systemic risk if left unchecked. In the months following the exposure, the hospital worked to repair its image and restore confidence in its care. Independent auditors were brought in to review ongoing surgeries, and patients were reassured that systems were now in place to prevent similar situations. Staff members were encouraged to report concerns without fear of retribution, creating a culture of vigilance. Policies were updated to ensure that personal relationships could not compromise professional responsibilities, and lessons from the case were incorporated into training programs for years to come. The affair that had remained hidden for 10 years ended not through confession, but through the silent records of machines, digital logs, and patterns too precise to ignore. Lives were not physically lost, yet the impact on trust, reputation, and professional integrity was undeniable. The story became a cautionary tale within the medical community, illustrating the dangerous intersection of personal desire and professional duty. It was a reminder that no matter how carefully a secret is maintained, in environments where lives depend on precision and vigilance, truth has a way of emerging. Ultimately, the hospital and its staff learned that vigilance cannot be replaced by reputation, and systems designed to protect life are only effective if consistently observed. The surgeon and anesthesiologist, once admired and trusted, became symbols of the hidden risks of mixing personal relationships with professional authority. Their decade-long affair had left a permanent mark, not just on their careers, but on the institution that had unknowingly sheltered it. The case concluded with lessons that resonated far beyond the walls of the operating room, that even in the most controlled environments, secrets can grow quietly, and the consequences of their exposure can be devastating.